I was, I was,
Yeah, I forgot.
it's all good. I can go back and we can re-record those first few. Um, I was I was validated. I shouldn't say surprised. I was validated to see that there was more than 3 decades worth of research documenting the association between increased heat and aggressive thoughts and behaviors. And these include family disturbances, suicide attempts and completions, rapes, assaults, social and political uprisings, and law enforcement interventions that escalate from a minor dispute to a violent assault or homicide. And international studies have consistently found that violent crime increases by 10% for every 2.5 degree increase in temperature, which is just astounding. So one theory is that the rises in temperature modulate serotonergic transmission, which may increase arousal and impulsivity, which then results in increased risk for violent incidents. Hence, this is kind of harkening back to our IPV in the case. I also wanted to just mention that eco or climate anxiety is something we should really be aware of, particularly in our young patients, but realistically in all of us in all of our communities. About 2/3 of us have climate anxiety. Over half of us as Americans feel that climate change is the biggest threat to our society. And I looked at a few of the recent surveys over the last 3 years when I originally made these slides, and it's pretty stable, pretty consistent with this data point still. And that astoundingly up to 3/4 of youth across the globe between 16 and 25 years old feel that the future is frightening due to climate change, and that they will have less opportunities than their parents did, which as a parent of 3 kids is very, very saddening to me. So here are some very sort of like high level solutions. We'll go into specific actions later in our presentation. But I like this because the beautiful elegance is that so many climate solutions also benefit mental health. So some of my favorite ones are active transit or physical commuting. So for example, many days of the week I like running. So I run my kids to school, they use their scooters, and my baby, I just have her in a stroller. It's not perfect, but I do my best with it. Also using green public transportation. Yes, we could go into that on a side note later, but yes, some public transportation, despite it mentioning that it's sustainable, is not fossil fuel free. And then increasing our access to green spaces, investing more in shade trees and infrastructure and forest therapy. I'm going to go into that in much more detail soon. Clean energy, reducing our personal carbon footprint, and then sharing positive stories of creative climate action. So I really wanted to focus here on like honing our equity lens because as many of us realize the intersection between health, climate change, and like health equity and health disparities it's just intimately intertwined. So I love this slide because it really shows that equity and equality are often used interchangeably, but should not be mistaken for being the same thing. So equality simply means that everyone is treated the exact same way, regardless of their needs or their individual differences. Whereas equity, which is what we're going for here in this movement, in this initiative, is that everyone is provided specifically what they need to succeed. And that many times is different for each individual or community. So let's demonstrate this concept of tree equity and heat islands so that we can see the intersectionality of all of this. So in this graphic, the downtown area, so like an urban downtown area, is a heat island. And heat islands can be up to 7 degrees or more. Unfortunately, this has worsened over the last few years, 7 degrees or more warmer in the daytime and up to 22 degrees warmer in the nighttime than surrounding rural areas and suburban communities that are affluent. So the reason for this disparity is something that is called tree equity, which was a new concept to me when I first started studying this. But this cool organization called American Forests has created this tree equity score in which 100 indicates that a given community or neighborhood has achieved the optimal tree equity. Basically, the higher score, the better. So I live in San Diego, and San Diego a couple years ago was actually designated one of the top 20 cities that has the most to gain by planting more trees with respect to improving health and equity while reducing greenhouse gases simultaneously. Um, It must have been I must have accidentally added some sort of transition that I didn't realize. Um, so this might seem like it's unrelated, but it's so intimately related. This graphic shows an example of redlining in the 1930s in San Diego. And I use San Diego because it's something I can relate to, but wherever you live, there will be the same disparity and that will be demonstrated. You'll be able, please think about how this applies to you and your neighborhood and surrounding neighborhoods in your county. Um, so basically, redlining, if you're not familiar with it, is an example of systemic racism in the United States, in which the federal government designated Black and immigrant and other minority communities as with really low grades, red grades, for home loans specifically. So then hence the term redlining was born. So as you can see, pretty much all of Southeast San Diego in the 1930s was redlined. And these are now neighborhoods that are also environmental justice communities because they were not invested in from an infrastructure point of view all of these decades. And they are also already, because of systemic racism, at higher risk. These communities and people are at higher risk of other health conditions, like low access to education, good paying jobs, healthful foods, safe spaces to exercise, and clean air. So you can see how I'm trying to merge these two concepts. So harkening back, let's look at this. So La Jolla, if anyone's ever visited San Diego or is just generally aware of San Diego, La Jolla is a very nice, affluent community by the coast, whereas Southeast San Diego, there are multiple neighborhoods that are what we call environmental justice communities. So then going back to this slide, I just want to demonstrate, I zoomed in to look at the tree equity. So you can see on the right, La Jolla has quite a high tree equity score, almost 90. Remember 100 being ideal or optimal. And La Jolla and all of its surrounding areas are pretty green. Now, if you look into on the left where I zoomed in more, all of those orange areas are areas in Southeast San Diego where there is very low tree equity. So, on the verge of 30 as compared to 90 out of 100. So unfortunately, systemic racism of the past has carried forward to the present and is affecting all of our communities' physical health and emotional well-being by virtue of having these built environments with less shade trees and green space and also more pollution and food deserts. So why is this important to us in the health community or the health adjacent community? It's because environmental justice is health justice, and redline communities have poor physical and mental health indices, and environmental justice communities, I'll call them EJ communities sometimes, are at higher risk of heat-related illnesses due to higher temperatures and air pollution and lower tree equity. These communities also lack resources and therefore are more likely to suffer from and not recover from climate disasters like flooding, droughts, wildfires, extreme heat, etc. Therefore, environmental justice is health justice. This is a really busy slide, but as a healthcare provider, it is really important for me to realize that my direct clinical care is really only 20% of the picture of a person or a community's health. These so-called social determinants of health, which make up the other 80% of a person or a community's health are really critical. And this is just another way to kind of look at these social determinants of health. And I added a sort of environmental or sustainability lens. So historically, for example, we talk about food security and access to nutritious foods. And this is, you'll see in our next case, very much uh, intertwined with environmental health and climate change as well. And then also, obviously, air quality and water quality are part of the built environment and incredibly important, as is like transportation, and then the actual like green shade space, safe space to exercise. So these are parts of the built environment of communities. So our next and last case is and I'll stop. Does anyone have any notes, comments, questions, feedback? I see there's one more chat thing. Every community has this impact of redlining and discrepancies in even how long they live. And I know this too well about East San Diego, where I used to be a nurse. Thank you, Vanessa. Exactly. I appreciate that personal story to really bring it home for all of us. So case 2, we're gonna go from a pregnant young adult now to a 4-year-old African American or Black boy. He's overweight. He was brought in by his dad for 1 month of increased fatigue in the daytime and difficulty breathing during soccer, which he started about 6 weeks ago, playing on a fall league team. And to note, the summer and the fall has been a very, very hot one. His exam shows that he has a mildly fast heartbeat. He has pale conjunctiva. Anyone who doesn't work, directly with patients, that's just this like usually pink sort of part of the inner eye. So if it's a lot whiter, that may be concerning. Labs show that indeed, he does have low hemoglobin and low iron stores. And his medical history is pretty non-significant. His vaccines are up to date, but his social history is really significant to this story. He also lives in an environmental justice community in a rented apartment that he shares with lots of people, 2 older siblings, 2 parents. They're low income, but just above the poverty line, so they don't have access to some resources that they would otherwise if they were below it. And they have no private transport. So I kind of gave it away in the prompt, but what is the likely diagnosis? What are we worried about for this patient? Anemia? I think I heard anemia. Yeah. Awesome. Yeah. So iron deficiency anemia, which we see relatively often, if we're treating patients. But the twist of this particular case is that his iron deficiency anemia has been caused or exacerbated by malnutrition because of climate change and specifically extreme heat related to climate change, in addition to all of his social risk factors contributing to iron deficiency anemia. So let's dive into that a little bit. There we go. So, climate change and malnutrition are directly related, but climate change impacts malnutrition in a couple different ways. And to me, it makes sense to just break it down into 2 categories. So, one of them is by decreasing the availability of nutritious foods. So, for example, drought caused by extreme heat and other climate change risk factors are reducing and destroying crop yield. I also highlight that there's other climate risk factors that affect availability in addition. And this can also cause supply chain disruption and cause increased costs and then exacerbate food deserts. So that all of those factors decrease availability. But something that I didn't realize until I started to dive into this world was that the nutrient density is also strongly impacted by climate change, including extreme heat and drought. For example, there will be reduced plant levels of nutritious protein, reduced plant levels of important micronutrients like zinc and iron, and then reduced productivity of livestock and marine sources of food. So really, this is incredibly concerning. You can tell on an individual basis for individual patients, but really for our entire national and international community, because if the food that we eat, which we all need to eat nutritious food, if that is being affected by the quality or the nutrient density therein and by availability, we can have a real double whammy of insufficient nutrition or malnutrition in our communities. It's actually from a couple of years ago. I double checked the today, and I was surprised to find that California is not an extreme drought as it was 2 to 3 years ago. It's temporarily improved, but as all of you know, if you live in California, we have had increased risks of prolonged drought due to climate change and extreme heat. So I want to go into look at malnutrition from an equity lens by briefly exploring this concept of food deserts. So a food desert is a region in which a large portion of low-income households don't have easy access to large grocery stores, which tend to carry more produce and healthful foods. So these neighborhoods then have more convenience stores and fast food restaurants, and they're therefore exposed to poor quality nutrition at higher rates than more affluent communities or communities that are not food deserts. Furthermore, low-income households are less likely to have private transportation and therefore not have access to these higher quality nutrient-rich foods that are outside of their direct community, simply because they can't get there easily or in a timely fashion. And going back to our case, children are uniquely vulnerable and at risk for malnutrition because of the impact on their development. So children, for example, that experience poor nutrition and micronutrient nutrition like iron deficiency are more likely to develop obesity, type 2 diabetes, hypertension, and heart disease later in life. And this is just, again, going back to my home, San Diego. You can see that, again, this is Southeast San Diego where I'm using my arrow to circle. And this is where a huge majority of San Diego's food deserts are. It's not coincidental that these correspond to our environmental justice and redline communities. So I really like this cartoon because it's like sadly funny, but it demonstrates. So basically, there's a food desert out in the distance, and this large man and I think it's a kid actually, and his mom are crawling along trying to get there past all of the processed foods with poor nutrient density, saying, I think I see an affordable healthy food on the horizon, and the mom goes, it's just a mirage. So it really shows how ingrained food insecurity is in these communities that have been redlined and that experience that are food deserts. So I had some specific points that I had written down, but I think I got to it in that little spiel. This is a super busy slide. I don't expect anybody to memorize this, but this just shows how all of our diets around the world are impacting global warming, climate change as well. So specifically, food systems are responsible for about a third of greenhouse gas emissions. And this highlights how the food that we produce and eat affects the environment. So if we can all push more towards shifting to sustainable, healthful diets, then we can reduce health and climate change costs by like over $1 trillion by 2030 in the US alone. So food systems are important for us to be mindful of and to address in our advocacy as well. So the good news is we can be part of the solution. So as I mentioned earlier, individual health equity, and climate change in my mind are intimately related. So any negative impact on one will affect all. In the same way, any positive impact on one will positively impact all the other two. So if we promote sustainable plant forward diets, we can improve individual health while also affecting the underlying systems that are contributing to or causing health inequity and the high emissions that then exacerbate climate change. One of my friends is a family medicine physician and a culinary medicine physician. She wears a couple of different hats, and she likes to show this protein scorecard to demonstrate how impactful it is if we can focus on more of a plant forward diet, which means not necessarily becoming vegan or vegetarian or never eating In-N-Out again. One of my patients was like absolutely frightened when I started talking about plant forward eating because of that. But really, it's more about filling our plate with more plant-based proteins and fewer animal-based proteins, and then adding more produce, of course, and less processed food across the board is always healthy. So if you look at this protein scorecard, you'll see that plant-based products like wheat, corn, beans, lentils, rice, soy, they both cost less from a financial and economic standpoint, and they produce the least greenhouse gas emissions per gram of protein as well. And then as a pro for us in the health community, they're also less inflammatory, less carcinogenic, and holistically better for mental and physical health. So really, I see a plant forward diet as a win-win-win with respect to climate change, health, and health equity and individual health. I think I saw someone in the chat. Let me just see if it's Vanessa says, here in San Diego and other places, all students can have healthy free breakfast and lunch at school. And over the summer, they need to keep this and SNAP funding in the federal Farm Bill. Yes, thank you for connecting this to advocacy, Vanessa. I completely agree. I can talk about it a little more later, but I was trying to work with San Diego Unified with this culinary medicine physician friend a couple of years ago to try to further increase the sustainable and healthy impact of the food in our school district. There we go. And I share this with my patients and my family and my friends because it's something that's really tangible. So it's an anecdote, but I think it works really well. It proves a purpose, proves a point. So 1 kilogram of beef, for example, or about 2 pounds of beef produces 120 times more greenhouse gas emissions than 1 kilogram of cauliflower, and is significantly more expensive. I made this slide a couple of years ago, and I just tried to find more recent prices, but suffice it to say, the prices of beef have gone up to I think over 10 to 20 pounds, $20 per pound when I was just looking at national averages. And cauliflower has stayed about the same. It might be $1 or $2 more expensive, but point being that cauliflower is significantly less expensive than beef from an economic standpoint, and it's also being integrated and used more as a versatile, healthful meat substitute that's more sustainable. So kind of getting to the end of my slides here, I like to organize our spheres of influence as healthcare providers and people that are healthcare adjacent into a few different categories. So, if we work directly with patients, we are trusted voices for patients. Healthcare providers on average, from year to year, are ranked one of the top 3, or like pretty much all of the top 3. I think nurses, pharmacists, and doctors have been the top 3 in one way, shape, or form for the last many, many years of trusted voices for our patients. So when we say something, it has a huge impact, which again is, I think, the impetus for why Climate Health Now was created in the first place. And then we are also educators. I put here for our colleagues and our trainees because I work with trainees a lot, but really we are educators for our friends and family in our communities as well. Whatever our scope is, we have an impact by using our voice as educators. And if we work in a healthcare system, or if we work in a school system, like a school system or anything else, whatever institution we work in, we're key players therein as well to make systems-based sustainability changes. And then we're advocates, which is a big tenet of what Climate Health Now's purpose and guiding mission is advocating for, in Climate Health Now in California, specifically for statewide advocacy projects and initiatives. And then, of course, we each have a carbon footprint. And I put that in there because I dislike the pitting these against each other. I think we can have a role in each of these spheres. I think we are all able to be versatile, diverse humans, and exist in multiple roles and scopes. So this is just something that I like to share. I really do work with my patients in an intentional way to when it's relevant, to integrate changes in their medicines, changes in their diet in a sustainable way. If someone says, I've never had allergies before, then I go into, well, climate change is impacting, due to extreme heat, is impacting the pollen seasons and the pollen concentrations. And therefore, you may be having allergies that you never had before. And then I also advocate for people to be their own proponents, their own health, be involved in their own health in a directed way. And I share with them certain ways that they can do that, get involved. So this in particular is like an air pollution or an air quality app, like airnow.gov. But obviously for the purposes of this conversation, like just looking like your weather app shows with respect to the temperature, and avoiding the times of day where there is more extreme heat, especially if we're exercising or avoiding exercising outdoors in those situations. And I kind of already talked about education, but again, we can all integrate into our climate lens into the way that we educate our friends, family, colleagues, etc. Within the healthcare system, I think that we have a huge opportunity to impact our own places of work, especially because healthcare is responsible for about 10% of national greenhouse gas emissions. So I encourage any of us who work in healthcare systems to look internally at implementing proven strategies to reduce hospital and surgical waste, prioritize the use of sustainable anesthesia practices, reduce energy waste, and invest in clean energy. And if you don't work in a healthcare system, then doing those same sort of practices, many of them are applicable to a multitude of other institutions, even outside of healthcare. And then kind of merging into advocacy, I won't talk a lot about it now because we have a few slides coming up here at the end. And then our own personal carbon footprint, we already touched on, but basically we can look internally at our own waste patterns, dietary choices, modes of transportation, et cetera, as part of the solutions as well. Here are some sources. And now I would love for us to collaborate and talk a little more. So I'm going to have Schwinn share. I'm going to stop sharing. Thank you. And before we get started, I just want to, I think it was probably Schwinn that asked this, put this question. How do we balance the reduced amount of protein in plants because of extreme heat with recommending a plant-based diet for patients with anemia, for example? I think that that's such a great point. So realistically, we may need, I don't claim to be the expert, a culinary expert or food systems expert on this yet, though it is a personal area of interest that I plan to get into more in the next year. So I imagine that the answer is probably going to be related to increasing certain types of plant-based proteins that aren't being as affected by extreme heat. Or I know from just my very cursory research that there are some farmers and I don't know what they're called, like food scientists, I think, who are specifically looking into heat resistant and climate generally resistant foods, specifically plants, for all the reasons we just stated, that will not be as impacted, that they'll be more climate resistant, resilient, for those reasons, so that the nutrient density is more maintained, and so that the actual like production and availability is not as negatively impacted by climate disasters. So great question, but I think that I think we're kind of like on the in the early stages of that, and I'm personally curious to learn more too. And Vanessa, thank you, Rachel. Important connection on diet and impact on greenhouse gases. Thank you, Vanessa. Okay, so wanting to open up some discussion, I would love for everyone to unmute if able, kind of sequentially, one at a time. But what have you seen in your work or personal life related to heat and its impacts on health?
I think I can start because I mean I live in the San Fernando Valley, which is, if you're not familiar with LA, it's quite hot here. Um, and I would say that it heat makes it so that even if you do want to have like active transport outside, like it's really hot. And so, I can't actually really walk, around and like I had a dog, and during the summer, like it was really hard to walk her out because we could only walk for a very short amount of time because her poor little paws would be burned and I would get really, really hot. And then, if I try to drag my kids with me and they're like little people, they are like, wow, this is too much. Like, I don't want to. So I do notice that there is definitely reduced physical exercise and all that stuff, and I just worry, and that's just me, my own experience, and then that's like compounded for my patients who, like may not have the opportunity. Like I have a large living room where I can have them run around, and I like bought a bouncy house like on Amazon just to like get them a mechanism for like kind of getting some exercise and jumping around when it's too hot outside. But it's definitely, a lot of patients like don't have that option, and you're just kind of trapped inside and it's really hot and air conditioning is expensive and fans can only do so much. So yeah, I think that that's definitely something that I've I've experienced. And I see Bill, his hand is up.
Well, just an example of how serious this can be. One of my other volunteer jobs is I run a docent program at a natural reserve that is owned and managed by UC Davis. And last month in July in Sacramento region, we had temperatures over 100 degrees virtually the whole month. And a couple in their 30s, fit, relatively young people, were hiking on the very exposed high ridge of this trail, and woman died of heat stroke. They actually called for this. So most of the trail does not have cellular access. You can't get some access at one end of the very high ridge. And they actually called for help. And you basically have to use a helicopter to rescue people from that trail. The helicopter took, I think, about 45 minutes to get there. And they hiked about another half mile down the trail. But by the time the rescue team came, she had died of heat stroke. So this is a real thing that happens to young, fit people and is not something to be ignored. And we at the reserve, we have at least half a dozen, if not a dozen, rescues off that trail every summer from people not bringing enough water and hiking the exposed trail. So it's a real deal.
I think Brenda just shared something around. Brenda, you want to share?
Yeah, sure. I just yesterday read an NPR article about how there have been several high school students who are football players who've died in the last month or two, which is so insane. These are children. And there are, I don't think they've found a final, determined cause of death for some of them, but some of them definitely from heat-related illnesses. And this relates to actually another article I at least just saw the headline for maybe a month ago about how maybe we should rethink starting school in August now, because August is hot for a lot of this country, and schools, if they're not built to support mitigating the heat for students, then it's not going to be a good learning environment for them.
Thank you so much, Brenda and Bill. And Brenda, it's like you are a plant, because we're going to talk about a specific action item through Climate Health now, very much related to climate safe schools. So that was a perfect plant. And I'll say briefly before we go on to the next discussion question that just before I started to talk with Schwinn prior to this presentation, I saw an article title, I didn't read it yet, that since 1999, so from 25 years ago, heat-related illnesses have gone up 117%, so more than 2 times in the last 25 years, which is frightening. So yes, I think all of this is incredibly relevant to health and health disparities, and I really appreciate all of you sharing your own personal and like health system related stories. Does anyone else have any input on this particular discussion question?
Well, in terms of what Brenda was saying, I saw that CIF, which, regulates the sports in schools, is saying that they have to restrict practice based on the temperature in, specific to each area. So limiting, how long and when they can practice, but also what's that thermometer that can, not only do the temperature, but also the humidity and other factors that impact how you experience heat. Do you know what I'm talking about, Rachel?
Yes. I don't know if I'm sure it does have a special name. I know exactly what you're talking about.
Bill
There we go.
knows.
Bill has
Yeah.
it. Wet bulb thermometer. Yeah, because humidity, the level of humidity dramatically changes exactly how we experience heat as individuals and communities. So it's a more accurate representation of the health risks. Wet bulb thermometer. Okay, I have to put that one in my brain. Thank you, Colleen, for sharing. Any other discussion?
I think Amanda has her hand up, Amanda Delmeda.
Oh, I see it now.
Yeah.
Thanks, Amanda. Go ahead.
Yeah, of course. I was just going to quickly add, hi, I'm Amanda, that I work with unhoused folks, and pretty much every single underlying medical condition seems to be exacerbated by the heat. And unfortunately, especially in downtown LA, like on Skid Row, there really isn't anywhere for them to go to escape the heat. So it's definitely impacting the most marginalized communities. And I also did a couple of rotations in the downtown LA jail. And they say during the summer, they have an influx of folks come into the jails just because that's when a lot of them are brought in. And then there's just not enough healthcare providers within the jails to provide adequate healthcare for them as well. So those are just some of my experiences.
Thank you for
Sorry, I
sharing.
was trying to unmute multiple clicks. Thanks for sharing, Amanda. And yeah, I wonder if, again, not being an expert on any sort of law enforcement and systems they're in, but I do wonder if the increase that you mentioned in the prevalence of jailings is increased in the summer for a related reason, because basically aggression, violence increases with heat. So I wonder if that's interrelated statistic as well. So next question, why is this an urgent issue? I think I'll probably start. That statistic that I saw before this presentation, that the last from 25 years ago to now, we have more than double heat related deaths, is why it's urgent. This is not something that we can dawdle on or wait another 25 years. We know that it's exponential. each degree of warming has other effects that will then cause a more exponential risk for climate change and global temperature rise. So that's my 2 cents on why it's an urgent issue. Anyone else have anything to add?
I think it's just like kind of what you were saying, which it impacts everything. It impacts so many aspects of our personal lives, and our patients' lives, and just every aspect of it. And the one thing that is concerning to me is that, like, when I'm talking to other people, that, like, if it's on a hot day, people are like really concerned, right, about extreme heat and all that. But then, like, in the dead of winter, like, people have just seemed to have like a collective like amnesia around how it's really bad. And then when it's summer again, it's like, oh, it's an issue again. And it's just really frustrating sometimes, to kind of make sure that people realize, like, it really does affect everything. Um Human nature is denial. Yes, I agree. But yeah. And Bill, is that in?
Yeah. And it's urgent also in terms of health system resilience. So if we get a major heat dome that covers a large geographic area, like we've had multiple times the last couple of summers, and couple that with the energy grid, the electrical grid not being able to keep up, our health systems are going to be overwhelmed. And I'm not sure that we've got a plan on how to handle that. So it'd be a much larger problem, much larger geographic area than what we see with wildfires or storms, hurricanes or something. If we get, hundreds of square miles that are experiencing extremely hot temperatures in conjunction with a power grid failure and lots of people getting sick and hospitals without power, it's going to be a disaster. So there really needs to be emergency disaster planning for extreme heat, particularly in conjunction with uncertain grid capability.
Yeah. And so I'm gonna kind of move us along because I just looked at the time really quickly. So we have a couple of actions. Actually, there's like 3. I'm really excited. I like crowdsourced actions, and then I got too many. So what was it? So there is a couple of things that we, as the healthcare community in California, like things that we can do that are really impactful. And I wanted to kind of help us build on what we're learning from Rachel today, as well as our own experiences, our own expertise. So there's the first action opportunity. So we have Colleen from Children Now here today, and thank you. You put in the link. Thank you. Thank you. All right. So actually, Colleen is writing an 18 to 20 page issue brief on the intersection of children's health and environmental and climate justice, which is what we just talked about. And she's looking for testimonials, and we kind of use the discussion questions. It's the same questions essentially, but she's looking to capture, the health community's responses to why this is important. And issue briefs are important, actually. They're really, really important because I have seen that, like, policymakers, their staffers, like, they really look at them and they use them as a base to generate policy ideas and also support legislation that's already kind of going through. And so, for example, like a policy brief around climate ready schools is like the entire foundation of SB 1182, which is our second action today. But like that's why these issue briefs are really, really important. And if we can get our voices out there to kind of substantiate, get that health community voice out there into these issue briefs, I think it makes it much more compelling. And so this is an opportunity for us to elevate our experiences and our expertise and to build that health case around policy. So yeah, so Colleen just put in the link to a form that we're hoping that everyone kind of goes into and kind of gives a testimonial, and then Colleen will reach out if she needs a little bit more. But yeah, sorry, one sec. Okay, and then so that's number 1, action opportunity number 1. So hoping you will click on that link. Action opportunity number 2 is SB 1182. So Vanessa, she is our campaign co-lead for the Climate Resilient School Act. So Vanessa, do you want to talk real quick about what SB 1182 is,
Yes.
and also what the action is?
Yeah, so just real quick, SB 1182 is asking that they form a coalition of people to come up with a climate action plan for climate resilient schools. So it's not all that we hoped for. It is, again, come this far to the point where, but it is important because it will have them act to actually develop this plan that will relate to infrastructure, concerns about heat, concerns about flooding, and give some guidance to the school districts so they know, how to best deal with that. Anyways, it has gotten through both the Senate and the Assembly, and now it's up to the governor to sign. And last year it got this far. It was another number, 394, but the governor vetoed it. So we need to let the governor know, you need to sign this, you need to enact it into law. And what we're asking you to do is just dial this number, which will take you to the governor's office in Sacramento, and share your name, who you are, as a healthcare provider, and that you can share also if you're a parent or a grandparent, which is significant, a member of Climate Health Now, and that you're calling to ask that the governor sign and enact into law SB 1182, a master plan for healthy, sustainable, and climate resilient schools. And then they usually ask you, but you can say also where you reside, your zip code. So we're actually asking you to do this now. We'll give you like 5 minutes. If you get a busy signal, just hang up and redial. It's again, they don't want a lot of information. It's just this, that you're asking the governor to sign SB 1182 and make it a law. Okay? What do you
All
think?
right.
Can we do this?
Well, we can do this, but I just wanted to also just kind of move really quickly to our third thing. So I've put it into my phone, and I will say that. And to Bill's point, you can just say like you're requesting the governor sign SB 1182, and that's good enough. And then also there is a link in the meeting chat that to do a sign-on letter, and then also sent out an email. We also just sent out an email like right before this, so that you can do a sign-on letter. Sign-on letters are not as impactful. I think the calls make a big difference. The volume of calls makes a big difference. And so then if you could do both, that would be great. Oh, yay, thanks. Thanks, Rachel. And so, yeah, so that is number 2. And then in my last minute, so this is really interesting. So there has been a dearth, I think, of the health community voices in talking about how we can actually adapt to extreme heat. Because there's a part of it that just is like, extreme heat is a problem. And there is already a set kind of temperature rise that's going to be happening no matter what in our lifetime. And so then we were asked to see whether or not we would be interested in kind of like building up kind of a advocacy working group within CHN to talk about policy and solutions and how to kind of work on this whole extreme heat issue. And so if there is any interest in the some kind of extreme heat advocacy working group, please let me know. You can put your name on the chat, or you can email us at connect@climatehealthnow.org, or we'll talk about it in the membership meeting next week. But yeah, I just wanted to kind of plant that seed because Rachel already, kind of gave us lots of good info. But we know there's still a lot more to do. And so we would love to do that. All right. So yeah, thank you, everyone. I really thank you so much for Rachel for sharing and starting off this conversation for us. This will be just the beginning, but I hope everybody actually dials the governor and supports SB 1182, and then we'll see you next week. All right, thank you.
Thank you all. See you.
Thank you. Bye bye.